Thank you for joining us today. I'm Kimberly Mashburn, the Absence Management Practice Lead at the Hartford. And we're glad you're joining us today for what will be a very informative and worthwhile session on how COVID-19 has affected caregivers in the workplace. Our presenters today are Dr. Adam Seidner, the Hartford's Chief Medical Officer, and Adele Spallone, Vice President of Clinical Operations. Dr. Seidner earned the Doctor of Medicine degree from the State University of New York, a master's degree in public health from the University of Connecticut, and a degree in anthropology from Hamilton College. His background includes working on vaccine development and testing, worksite health promotion, integrative pain management, and fitness for work. Adele Spallone earned a master's degree in mental health counseling and marriage and family therapy, and is a licensed mental health and family therapist. One of her accountabilities is oversight of the Hartford's Behavioral Health Unit, which has won awards for innovations in assisting employees to return to work. Dr. Seidner?
Good day. COVID-19 has made it difficult for your members because they're juggling elder care, household management, child care, and work. And if we take a look at the pie chart on the left, you can see the percent of men and women in the U.S. workforce. If you look at the bar charts on the right, it shows households with parents. And you can see the differential between mothers and fathers in the workplace based on the child's age. Households for children under 6 have less females working, but it increases for women between the ages of 6 and 17. So today we're going to talk a little bit more and level set about COVID-19. We have to realize some of the metrics which are important, which are the number of cases, hospitalizations, case fatality rates, ventilation use, intensive care unit admissions. All of that is important. Next slide. And so with that, we have to recognize that we have 75 million estimated remote workers. 124,000 public and private schools have been closed and are now reopening. And there's been over 55 million students that were sent home and are now returning to some form of school, whether it be remote, a hybrid, or in-person combination. There are a number of effects on mental health for your members that we have to keep in mind. We want to make sure that they don't become depressed, burned out, have anxiety, or develop even PTSD during this time of burden. One of the things that we need to also recognize for members is that everyone has a circadian rhythm, meaning your hormones change throughout the day. Cortisol increases in the morning, melatonin increases at night when you're going to go to sleep. And so it's important to keep a regular routine through the day. There should be regular exercise, not decreased exercise. Otherwise, there may be more fatigue. If, again, people are not waking and sleeping in the same pattern, they can develop an insulin resistance, which can cause what's called a metabolic syndrome, where the insulin isn't properly used by tissues, and they can also wind up gaining weight. And this is beyond just diet and exercise. It has to do with not sleeping properly. Next slide. Some of the things that we have to worry about is with the isolation is the rise that we see in domestic violence or intimate partner violence. And so we've seen increase in police calls by 20%. And if you look back at Hurricane Katrina, Schumacher in Violence Victims publication, they looked 6 months before and after Hurricane Katrina, and they saw a significant increase in psychological violence and also physical victimization. The psychological went from a baseline of 33.6% to over 45%, and there was an increase seen in both females and males. Physical victimization also doubled from about 4% to 8%. So we need to keep in mind that There are disaster distress helplines, 211 calls that can be made. We also have domestic violence hotlines, which are important. Other resources include SAMHSA, which is the Substance Abuse and Mental Health Services Administration, as well as the CDC has mental health and coping during COVID-19. All these are important for your members to know about and access when they need them. Next picture. So taking care of yourself, what to do. I mentioned that we have a circadian rhythm and we should have a regular schedule. So I would recommend first and foremost, limit exposure to the news. It's on 24/7. It shouldn't be on at your house 24/7. So limit the times that you're going to take in the news, whether it be on television or whether it be reading materials or on the computer. The next thing is to make time to relax. Really take time, take deep breaths, listen to music, play music. All of that is important to have that me time. Also, you want to be able to eat healthy. Make sure that you avoid some of the fast foods and unhealthy diet, as that can have an impact on how you feel as well. I already mentioned that we should be exercising regularly, and that should continue through this pandemic. And then finally, sleep regular hours. That's also important. As part of your routine, when you get up, shower, get dressed, don't stay in your pajamas all day. And the other thing to keep in mind is that you can volunteer and help others. That will make you feel better as well. So finally, we need to really focus in and support the children. Children in the pandemic, we need to watch them. We need to watch for excessive crying in younger children. We need to look for any acting out that we'll see in the children. If they lose interest in favorite activities, that's something we need to be aware of as well. And we need to be able to identify if there's any worry or sadness in the children. So we need to support our children, make sure that they have good sleep, identify if they have any anxiety or nightmares, and more important is just ask them how they feel and listen. Talk to them about COVID-19, reassure their safety, limit family exposure to the news, as I've already mentioned, and be a role model. It's really important that they see how you are behaving. They will pick up on a lot of nuances. So be a good role model and be attentive to these signs of any behavior changes that you might see in your children.
So as we can see, the COVID world has changed and transformed all of us. While people have been working from home, they've had to incorporate increased responsibilities in their day more than ever. We've been teaching, and sometimes it's teaching a child whose style of learning doesn't align with virtual education. We've been partnering, we've been parenting, we've been cooking, we've been cleaning, we've been paying bills, all the while sheltering at home with the family. And for many of your members, many of these additional responsibilities have come without any formal training or coaching. So stress and anxiety as a result of living in this new normal is being felt by everyone and in various degrees. There's not one person who isn't affected. So what is the recipe for happiness? It's the need to balance self-time and the need to balance family, finances, and work. The proper balance will help one avoid exhaustion, anger, and depression. Next slide. So where do we stand now? Well, unfortunately, COVID didn't end over the summer, and there doesn't seem to be an end in sight, especially for those that are living in hotspots. We're all seeing, a lack of coordinated strategy at both the national and local levels that creates continued fear and uncertainty. There's high levels of frustration and anger over the constant bombardment of news that's laced with conflicting guidance and information. There's social unrest, as some are opting to continue some level of quarantine depending on where they live, and this means continued isolation. So we're really seeing boundaries being blurred between work, home, and school. We've all experienced summer events and celebrations changing, such as graduations, birthdays, weddings, vacations, either being canceled or converted to virtual events. We are, in fact, mourning and grieving the social life we used to know. And there's unrest about going back to the work site while working, as well as what's happening with our children and their education, especially as we think about the future. Next slide. So how can adults cope in the midst of all this unrest? And I love this graphic because today we've had to become superheroes of sorts. And when I was thinking about the superheroes that we grew up in, when we saw in comic books or movies, they had these great superpowers with the ability to save the world, yet they were able to go home at the end of the day and detach from their worldly responsibilities. Today's superhero is a little different, and it doesn't matter what professional role they're in. And we could be talking about a teacher, a CEO, somebody that runs a small business, that leads an IT initiative, a hairdresser, a chef, an architect. They don't get to walk away from all their responsibilities at the end of the workday. And many are absolutely running a household on a shoestring budget. They might be primary caretaker of kids, or as like in my case, they could be geriatric kids. I have parents who are in their 80s that I'm primarily responsible for. So we now have a psychological, social, and familiar responsibility with the ultimate job of saving people and their lives. The stressors are absolutely real, and the impacts that COVID have are real. So when I was starting to think about, how to best approach getting through this, I started to read articles on the various coping strategies that people have used during difficult times. And I've read about longevity of people in blue zones and read about people who survived events like the Holocaust. But I came across many articles on resiliency. And while I understand that every situation is different, I found one article that showed characteristics from a study conducted by Columbia University that I thought were important to share. So resilient people are people that are able to bounce back from difficult situations because it's not that they just have a positive outlook, but they have a very realistic one. They find meaning amid crisis, and they're able to turn life's negative aspects into something constructive or positive. Resilient people are guided by a strong sense of what they consider right and wrong, and they use that as their moral compass. They absolutely believe in a power greater than themselves, and they are regularly connected to either a religion or spiritual practice. And a spiritual practice can include things like regular breathing exercises, incorporation of yoga or meditation in their daily routines. They have a concern for others and often find a sense of purpose when helping people. And finally, resilient people don't go it alone. They invest in social connections and maintain a very, very strong support system. So these characteristics can be useful in navigating the challenges that COVID has brought us.
Signs ahead with regard to COVID-19. And I just want to walk through some of those positive developments that we've been seeing. First, we have to understand that there are different types of tests that are available for COVID-19. The first group of tests are diagnostic tests, and those look at an antigen, and they use something called a PCR testing or polymerase chain reaction. There's also an IFA, immunofluorescent antibody or antigen testing as well. These tests tell you if you have COVID currently. The other test group is a surveillance test, and that's the antibody test. And we've moved beyond just do you have antibodies to not have antibodies to basically semi-qualitative testing that's being done in some cases. So it's very helpful to go from that qualitative to quantitative testing because we are able then to determine how much antibody, relatively speaking, an individual has, because as we know, the antibodies decrease over time, and usually less than 17% have significant antibodies after infection after just 3 months. The other things that we've been seeing that have been helpful is that we have medical engagement protocols now, which have resulted in decreased death, decreased mechanical ventilation, and an improvement in overall recovery. So the medical treatments run from remdesivir, which is an antiviral medication, which is shown to help, to how we use oxygen. Not everyone needs to be on a mechanical ventilation. So there's other means of delivering oxygen to people. We know that some folks with COVID-19 are prone to developing clots, and so many of the patients going into the hospital may be put on a blood thinner called heparin. And then we also know the importance of treating cardiovascular disease, so managing the hypertension, the high blood pressure, or high cholesterols. And then finally, we have a number of immune modulators that are being used to make sure that the immune system doesn't overreact. And that's dexamethasone, which is a steroid, and that methylprednisone has been combined with other immune modulators. Finally, we have the vaccine. And the vaccine, we have over 180 in development, and realize it usually takes 5 or 10 years to develop the vaccine in the United States. And I firmly believe that in 18 months, we will have a vaccine. So sometime next year in 2021, a vaccine should be available. Realize that vaccine testing has to go through a number of different steps. We have the preclinical, and then we move into the clinical. That's the phase testing that's done on individual people. And so we've got approximately 8 phase 3 clinical trials right now ongoing. After the trials are completed and the information is obtained, it goes to the regulators for approval. And then finally, after approval, there's a manufacturing and distribution process. This is where the government will be helping in making sure that we have enough vaccine and get it distributed to those that need it. And then even after that's completed, there's a whole quality control aspect that we'll be monitoring. There is one trial that has been put on pause because of a potential severe adverse event. This is not uncommon during vaccine trials, and so they need to determine the nature of the condition and also whether they believe it was secondary to the vaccine that's been developed. So one of the trials has been paused, but once they understand what that condition is, it will most likely start up again. And then don't forget that the public health behaviors really have helped and do help. So remember, the social distancing is important. Wearing face masks is important. Either quarantining or self-isolation if in fact you feel ill or have been exposed. And then we need to have the ability to do the contact tracing. But don't forget about all the hand washing, the surface cleaning, the respiratory hygiene. So if you use a Kleenex, dispose of it properly, and cough etiquette. Even when wearing a mask, cough into your arm, and then you can basically be assured that you're not spreading the virus if indeed you're infected. So I just wanted to read this quote, which really, I think, highlights a lot of the stress and that your members are undergoing. And I don't want to hold the weight of the world on my shoulders anymore. I have 40 pounds to hold on my lap. That's a lot, don't you think? And I do. I think that is a lot. And we really need to make sure that we take care of the parents, the children, and that everyone's taking care of themselves. So we have to realize that child abuse or neglect is 5 times higher for families in the lower socioeconomic versus the higher socioeconomic strata. And so taking care of yourself, seeking help, and asking the children how they feel and listening is really critical to making sure that we all go and get through this pandemic as best we can. Thank you.
Thank you, Dr. Seidner and Adele, for your great insights. Let's recap a little bit. Balancing work and home has never been more challenging for caregivers than right now. And as we've heard, we all need to take care of ourselves. We need to make sure we're staying socially connected. As Dr. Seidner and Adele both said, we need to try to get some form of exercise into our world. And for me, that exercise used to be walking in airports. And now without travel, I'm having to find new ways of doing that. So rather than connecting with coworkers by sitting in front of a computer, we're doing more walkie-talkies where we take our conversations out for walks. So just some things that I've been having to do personally in order to get through this. And I'm sure your members are thinking about those things as well. Your members also need access to information. They also need information about their benefits at this time, particularly their medical benefits like telehealth if it's available, as well as EAPs. So we've added some resources here for your review. As was mentioned earlier, the National Domestic Violence Hotline, the Substance Abuse and Mental Health Services Administration, and the Distress Helpline. Again, thank you so much for joining us today. We hope this has been helpful.